So if the researcher is going to talk to these individual people and get their views, the researcher retains all the power to decide what to do with that. And what's desperately, desperately important is that that power is shared and that there's a reciprocal relationship, because that's what makes for really good involvement activity.
Hello there, I'm Sarah McCluskey and this is Research Adjacent. Each episode I talk to amazing research adjacent professionals about what they do and why it makes a difference. Keep listening to find out why we think the research adjacent space is where the real magic happens. Today's guest is Colin Wilkinson. Colin is a public involvement specialist who lives and works in Stockton-on-Tees in North East England. Full disclosure, Colin and I have been friends and colleagues for over 20 years, since he gave me my second ever proper job back in 2002. We used to run huge schools events together, but inflammatory arthritis means that Colin's mobility isn't as good as it used to be. However, as he explains in the podcast, he's found that a lot of the same skills can be applied to the work that he does now. Colin works with organisations like Versus Arthritis and the National Institute for Clinical Excellence and the National Institute for Health Research to help ensure that research and guidelines genuinely take lived experience into account. In our conversation, Colin talks about his career path, including his successes and challenges. We also talk about what makes for great public involvement, with advice for researchers and research adjacent professionals trying to do better in this area. Welcome along, Colin, and thanks for joining us today. I wonder if you could start by just telling us a bit about what you do and how you find yourself in this research adjacent space.
Right, well, that's a fairly long story. I'll start at the beginning. When I was doing my degree, I was sponsored by British Steel and I was doing a chemistry degree. So I was working for British Steel as well as studying. I was discovering that if you were going to work in industry, doing a chemistry degree, certainly the way I did it, wasn't the best preparation for doing that. So I got quite frustrated with that and decided I wanted to change that, and managed to get funding from a chemical company to do a PhD, but couldn't find anybody who would supervise me to do it the way I wanted to. And then went to do a master's in communicating science while I thought a bit more about it, and then became passionate about getting people engaged with science and the ideas around it. And obviously, because science is mainly research, that fit very closely as a kind of research adjacent career, because, as you know, because we worked together then, we did a lot of stuff with researchers who were explaining the cutting edge of science, which is what tends to get the public really excited, whether it's discovering a new kind of dinosaur or unraveling genetic codes and genomes or understanding the way particular molecules behave under certain circumstances. There are parts of science that have always got the public excited, and that's the hook that you use to sort of raise awareness of the way science works, because once people start to understand how science works, it's much easier to get excited about more of it. Having done that, I then set up on my own and started doing more stuff to do with science education and public engagement, which obviously a lot of that was to do with research, particularly as I was working a lot on the Crest Award scheme, which is an award scheme for students in schools who are actually doing research themselves. It might be on something as simple as which kind of soap works the best, but it's a great preparation for understanding how science works, so that students have a better chance of understanding the knowledge that they learn as part of the science curriculum. And then working alongside researchers who were supervising students sometimes was really interesting, and working on the UK Young Scientist and Young Engineer of the Year competition as well, which was just a fabulous experience, and then helping to chair the judging at many events, where you are literally looking at every area of science all at once and trying to decide which students get the prizes is a really difficult thing to do, but it really makes you think about the sort of values that underpin science. And that to me is one of the really interesting things about everything I've done, that it comes down to what are the values that we have when we do science, and how do we communicate to the public that those values are fairly decent ones that everybody can subscribe to, and that science isn't a hidden, secretive endeavor that is in thrall to companies or businesses. And that's a lot of what you hear about scientific research is it's all funded by pharmaceutical companies or companies in a particular area. And the suspicion that comes from that is really dangerous to science, but entirely understandable. And I also, in tandem with that, I've been developing inflammatory arthritis, which is no fun. But that's led me to get involved in involvement in health research. And that journey to learning how to understand particularly which proposal should get funded is quite similar to judging science projects that students have done, in that you are looking at the values that underpin the research and also the value that it brings to the community. And having done lots of public engagement activity, it was very clear that people get more excited about research that's going to make a real difference to people. And trying to evaluate one research proposal against another and look at which one would add the most value to society is one of the things I really relish and really enjoy. But also looking at how those proposals are being created with the people who are living with the disease they are trying to address is part of those values that sadly is often missing or not done terribly well. And I've got more involved in that now, and there is a real challenge of changing the research culture, which can only be done with researchers, but also needs the support of people like us who work in research adjacent activity to make a real difference to the way research is done. And that's kind of where I have ended up where I am today, doing lots of stuff about funding fellowships for researchers and doing lots of stuff around who gets what money for what, which I find really interesting, really enjoyable, and really challenging. And that's what I need to keep stretching me in ways that most other things don't.
Great. Thank you so much for that summary, Colin. So it's clear from the way you've talked there that you've done lots of things in your career that you're really proud of, that you feel have really made a difference. I wonder if you could tell me about something that you've been working on recently that you feel really proud of.
I think the thing of which I feel proudest at the moment is my work on the Shared Commitment to Public Involvement, which is a group of research organisations that have got together to say, okay, we have UK standards for public involvement in research, but still the quality of proposals that are coming through to funders and the way that researchers are doing involvement isn't particularly wonderful. And there are lots of proposals where involvement is practically absent or given such light treatment that it's barely worth funding the involvement activity, because it's not involvement in the true sense of the word as I understand it, and as a lot of the organisations involved in that shared commitment understand it. And the idea of this is that by making a shared statement about what public involvement is, and that there is nowhere in health research where it's not important, expected, and possible, that we are going hopefully to start changing that research culture as I talked about. But the way the work on that shared commitment has been done, it's been done in a way that is absolutely in the spirit of active involvement. And it's provided those aspects of activity around involvement that are desperately important and so often done badly. So that the public contributors like me who've been involved have been supported all the way through. We've been in charge all the way through. Our opinions have been respected, listened to. It hasn't been somebody else designing something and then coming to us and asking us what we think about it. The conversations have started with us, and then gone to the staff of these organisations, and they've then gone up the chain, and the chief executives or director of something or other has signed off on what the text is. So there's a shared commitment text between all of the organisations, and then each organisation has said what it's going to do to get there. And that is, if somebody said to you now that was going to happen, you would say, "Don't be ridiculous. That'll never happen." And it happened within 3 months. You know, there was in a very short space of time, all of those organisations had said, "Right, this is what we agree to, and yeah, we'll work on the wording," and it was done. It was astonishing.
Excellent.
And I'm now co-chairing the steering committee for that shared commitment as we try to expand the range of organisations involved and move it forward and move the state of active involvement in research forward.
And is that something that's out in the public domain now? Could people go
It
and
is,
look
yes.
at it?
If you search for shared commitment to public involvement, you'll find it.
Brilliant. Okay, yeah, and I'll see if I can get a link for that, and we'll put it in the show notes as well.
Absolutely.
So what do you find are the biggest challenges of the work that you do? You've touched on some of them.
The biggest challenges for me personally are that a lot of this is done face to face now. And when you have a disability, that means it's very difficult for you to travel, and it hurts, and it takes you time to recover after you've done this. That creates a problem. So we are missing lots of different people in involvement, but it's particularly difficult for people who have disabilities that make sitting still for a long period of time very difficult. We're also missing people from different ethnic minority backgrounds and people who aren't fortunate enough to be able to cope with an irregular income, and people who live in poorer areas and perhaps don't feel that they should be getting involved in this rarefied scientific world. And we have to break those barriers down, because we're missing those who are least well served by health services in the involvement. And there is work going on to advance that, but it takes a long time and it's very difficult.
What sorts of things have you seen that help to break down those barriers?
Well, there are training courses now in cultural competency for researchers, which is a really interesting area, because that's part of making people feel welcome and respecting their cultural background once you get them involved. And it also helps to get them involved as well, because you are going to them in a way that works for them. And I quite early in my career, when I was doing my master's, I read a book about visitor studies, and it urged people who were designing visitor attractions to start where the visitor is. And I've always borne that in mind in everything I've done, that you always have to start where the person you want to do something is, because otherwise you won't get them to where you would desperately like them to be. And we used to generate a lot of funding for the work we did, and we did that partly because we started thinking about it, even though it was like we were trying to sell somebody nothing. They weren't getting anything out of this trade, but they were going to give us some money. So how do we persuade them to give us money? Well, you start with what they want, and you shape what you ask them for money for around what they want. And that sometimes that's the way you present it. Sometimes it's actually what you offer them. But there is a lot of work going on now to look at how you can start where people are to get them involved in research. But what often happens in that is that you lose the group dynamic that's so important in involvement in research, because it requires a discussion between people who have different experiences of a health condition and the researchers. So if the researcher is going to talk to these individual people and get their views, the researcher retains all the power to decide what to do with that. And what's desperately, desperately important is that power is shared and that there's a reciprocal relationship, because that's what makes for really good involvement activity.
So could you tell me, Colin, for you, what does it look like or feel like when involvement is done right, it's done well?
I know what it feels like when I'm involved in something that I feel is done right. It's where the decisions are made by everybody. And yeah, if you've got a lot of people involved in something, that's not always possible. But I know that the decisions are shared between the various groups of stakeholders in that piece of work, that there is a recognition that everybody has to get something out of it. There has to be what I refer to as a WIFM, or what's in it for me. And if you can get that right so that everybody gets something out of it, then it'll work and you'll keep people engaged. But also you've got to have a sufficient range of people involved that you capture the whole experience of a condition as far as is possible. And that often, and that doesn't just mean diversity in the sense of the sort of protected characteristics inequality legislation.
Yeah.
It means experiences of healthcare from somebody who has had a really amazing experience of care and somebody who's had a terrible experience of care, and lots of people along the way in between. And that requires sometimes quite a large number of people to be involved, but they don't all have to be involved to the same degree. There just has to be that sort of that recognition that sharing in decisions is important, that capturing the diversity of experiences of a condition is important, and that making sure that everybody gets something out of it is important as well. And when I've done it and I've seen that, it feels really nice. And when you see it in a proposal, you know it's going to work. And that's what I look for, is those three things: the sharing of power, the diversity, and the what's often called reciprocity, which is a bit of a strange thing because it sounds like a trade. When it's not, it has to be building a relationship that both sides get something out of, or all sides get something out of.
And what advice would you give to researchers, though, who were trying to approach involvement?
Oh, crumbs. There's so much. I think thinking about what's in it for the people you're trying to involve, beyond the fact that you're going to compensate them for their time, which is just an entitlement.
Yeah.
What's in it for them that's going to benefit them, and how are you going to build a relationship with them, which is what often gets lost. It becomes quite transactional. But what's really important is building that relationship so they come to know a little of your world as a researcher, but you also learn a lot about their world as somebody living with the condition you're investigating. And it doesn't matter whether you were doing work in mouse models, or whether you're doing a clinical trial, or whether you're doing health services research, or whether you're doing health data research. You cannot interpret what you're seeing without reference to people who live with that condition every day. And if I see another clinician say, oh, well, I see lots of patients in clinic, I know what they need. Well, you don't, because you see them for 15 minutes, every 4 or 6 months. And that's not understanding their day-to-day experience. Yeah. Because when they come and see you, they're asking you the two most important things that they need to sort out, because they know they've only got 15 minutes. And you've got to understand what the 24/7 experience of a condition is like to be able to create solutions that work for the people who live with it.
So on that note, if you had a magic wand and a limitless budget, how would you do things differently in this public involvement world?
So currently, I think public involvement and public engagement are evolving as separate sort of research adjacent disciplines. And in science generally, I think we need to recognize that because it's largely the public that pays for research, whether it's through donations to charities or through taxation, that science needs to learn to be more accountable to the public. And I don't mean in the sense that the public should decide absolutely who gets funded for what. There is a lot about research funding that has to remain a joint choice between people who don't work in science and people who really deeply understand the research that's proposed. I do think that there has to be a move towards science as a joint endeavor between scientists and the public. And I don't really know how to do that because it's a really complicated challenge. but I would love to get some of the brightest minds working in science and working in public involvement and engagement together to work out what to do, to fund some pilot projects, and then work out what to do and do it on a national scale. Because that's what it's going to take.
Yeah.
Nobody knows how to do that. Nobody knows how to do this, and anybody who tells you they do is lying.
Well, you do have a magic wand after all in this scenario, so you can
Lucky me.
make it happen. Those are the questions that I wanted to ask you about. But is there anything that you would like to talk about that I haven't given you an opportunity to do?
I think there is so in these research adjacent disciplines where you are doing things that support and enrich research, there is a tendency for researchers to try and turn them into research. So when I look at proposals, I see an enormous number of proposals that talk about focus groups as involvement, or talk about presenting at a science festival as contributing to involvement in research, which in a way they do, but they're not active involvement in research. And that dichotomy between research and involvement is one of the most poorly understood dichotomies that I've seen. And I think trying to attack that so that there is this shared understanding of what good looks like is really important. And I also think there is a tendency in some funders to see involvement as something that people like me, public contributors, are qualified to comment on, and the research as something that researchers are qualified to comment on. Whereas actually researchers are just as capable of commenting on public involvement as public contributors are of commenting on research. And when you get that combined knowledge, everybody wins and everybody goes away with a better understanding of what active involvement looks like. And that to me is one of the key challenges that I think we need to address, is how we get everybody to have that shared understanding. And the work on the shared commitment to public involvement will help that, but it's going to take a hell of a long time because it's a really big challenge, and there's 100 and odd universities out there, and there are people in those universities who have perhaps different conceptions of what active involvement is, and solving any challenge like that is always different because there's so many people who have to understand it.
Yeah.
And there will always be people who will never agree with you, and that's fine. But there needs to be a move towards a bigger shared commitment and shared understanding of public involvement.
Couldn't agree more. Yeah. I think there are some like you, I've seen some really great examples, but also some really not so great examples in this space.
And I don't think that's because people set out to do it badly.
Yeah, absolutely.
It's because there is value for researchers in turning involvement into research because it can help their academic impact, because they'll have something else to publish.
Yep.
But as a public contributor living with a number of health conditions, I really don't care about what an academic publication record is. That does nothing for me. What does help me and make me feel that research is valuable is that, yes, it gets published, but when it gets published, it's done in such a way that the way that research is presented and the research itself are determined by a partnership between academic and public contributors to research. And I think changing that power imbalance is one of the things that will help us get to where we need to get to.
I think there are moves in that direction, but as ever, it's slow.
Absolutely.
Oh, well, thank you so much, Colin. This has been a really interesting conversation. If people want to find out more about you or your work, is there anywhere that you would direct them to?
I do have a very amateur website, which we'll give you the link to. It's for my self-employed work, which I'm not doing just at the moment, but hopefully might be starting again soon. But it'll give you an idea of what I do.
Okay, that's great. What's the web address there?
It's if you search for Corylus Services,
yeah,
it's a Google site,
right?
So you can't miss it.
That's great. And yeah, again, we'll get the link and put it in the show notes.
Absolutely.
Well, it just remains to say thank you so much, Colin, for giving us this little insight into the public involvement research adjacent space that you are abiding in at the moment.
And thank you. It's been really interesting.
Thanks for listening to Research Adjacent. You can find show notes and other episodes at researchadjacent.com. I would absolutely love to hear what you think of the show, so please get in touch. You can drop us a message via researchadjacent.com or find us on social media at resadjacent. And if you've enjoyed the show, please think about sharing it, subscribing or leaving a review so that other people can find us too. Research Adjacent is presented and produced by Sarah McCluskey, and you, yes you, get a big gold star for listening right to the end. See you next time.